Welcome to our event, Medicare, Making the Choice That's Right for You. My name is Andy Young. I'm the financial advisor here at the Life Wealth Group. So I want to welcome you to our webinar here today. We will be getting started in about 2 minutes. So as we're waiting with that, if you have any questions, you can put that into the chat on the right-hand side. So we will be getting started in about 2 minutes. All right, for those of you joining on, we will be getting started in about 2 minutes. There's a link that is to the right that you can hit that looks like a little chat window. That will allow you to put in any questions that you might have with that. It'll send it directly to me. So if those questions, if you're watching this on replay, will actually email me so that I can respond to you at a later date. So if you didn't get to join us live, that will be available in the replay. All right, so I've got 12 o'clock on my end. We're going to go ahead and get started. Again, for those of you that have just logged on, to the right-hand side of your page, there is a chat window that you can click on with any questions you might have specifically for yourself. If it's something individual that you want to ask that maybe you don't want to be on that, there is a link as well that you should be able to hit to schedule a complimentary conversation with me. It'll take you directly to my calendar so that we can schedule a time to help with your individual questions, or just simply email me, andy@lifewealthgroup.com. So without further ado, we'll go ahead and get started today. It should take us about 25 minutes with this. If you're unable to stay for the entire presentation, there will be an automatic replay email that goes out tomorrow. So I'm happy to share this with you guys on behalf of the Life Wealth Group. So to take care of the compliance folks, to make sure that everybody's happy with that, we want to cover and we want to say, hey, when we look at this, we say the material that I'm providing is going to be generic. It's not specific to you. I'm not telling you to individually do this. That would be something that we would need to have in an individual conversation. So there is an opportunity that you can have that conversation privately with me, and I'm happy to help out with your questions. So what are we going to cover today? We're going to be covering the basics of what is Medicare. Maybe you're looking at this because as part of your retirement plan that this is going to be coming up for you in the next couple years. We're going to be going over about Medicare supplements, prescription drug coverage, and important dates to remember. There's a really important date for those of you out there that might be looking at Medicare Advantage plans. And if you're watching this today on the 6th, that date ends tomorrow, so it is the 7th. So hopefully this information helps you out with what you need, and we can look at options to help you out. So why is it important to us? Why do we care about Medicare supplements here at the firm? Well, the number one reason is because healthcare costs keep going up. It was $3.5 trillion that was spent in 2017. And the fear around this is because healthcare spending is projected, it's going to keep growing, not at the inflation rate of 3 or 3.2%. It's going up by 5.5% a year. So it's a huge impact on people's retirement pictures. When we look at the healthcare premium cost, it can be a huge effect on retirement, because let's look back in 1999. From 99 to 2018, inflation, we went up by about 51%. People's earnings luckily outpaced that, but health insurance premiums have went up tremendously, up 239% over that time. So people worry, often when they come in, they're worried about dying too soon. On the flip side of that is I'm going to live too long and health insurance is going to be too expensive. So there's obviously a big concern for people in retirement, and it's healthcare expenses. And when you're 65 or older, that's almost 14% of your income. So that's going to go across the board. If we look at that, 8% of the spending for all ages, but if we look at just 65 and older, almost 14%. It's huge. So the government has stepped in years ago and said, we're going to try to help reduce this burden by offering Medicare. So what exactly is Medicare? So it's the largest health insurance program offered by the government. Serves over 55 million people, and it's growing daily. So it's part of the U.S. Department of Health and Human Services. And this is where we get into the alphabet soup of Medicare. It's divided into three parts. You've got Part A and Part B are what is known as Original Medicare. Part C is going to be an Advantage plan. That's what you've heard so much about in the last few weeks, is a Medicare Advantage plan. And then Part D is going to be for prescription drugs. So let's break it down a little bit further with that. So Part A is going to help you to cover your hospital, the skilled nursing facilities, some hospice coverage, and some home health. A lot of people look at that as just the regular hospital insurance. Part B, think of it as your doctor insurance. And that's going to cover doctor appointments, preventative services, durable medical equipment. And it's important that you know that neither Part A or B are going to cover things like going to the dentist, going to the eye doctor, nothing for dentures, nothing for hearing aids, or any health care outside of the U.S. So if you plan on going out of the country, your original Medicare from the federal government will offer no coverage with that. If we look at Part C, that's going to cover everything that A and B cover that we just went over, but a lot of times it will add extra perks and incentives like dental, vision, or wellness programs. A good example of this would be, I used to manage health clubs years ago, and we would have people that would come in and join the health club at no cost because it was included with their Medicare supplement plan through Silver Sneakers. So it allows people some other opportunities to be able to enjoy with that. Part D is going to be for drugs, prescription drugs. That's all that it is. So how do you actually get this coverage? So when we look at our coverage, most people get their Medicare in one of two ways. They either get the original Medicare, Part A and Part B, and then they might add a Medicare supplement as well as a standalone prescription drug plan. So that's going to be one option. Option two is going to be that they go get a Medicare Advantage plan. Remember, that was Part C, and that often is going to have it bundled inside of there, the coverage for the drugs. So your Part D is built in with that as well. So it gives people really two different ways that they're going to be covered. Some people opt to just have the Part A and B, and they say, I will take it all on me if anything above and beyond that happens. But that's one of the things that we have to look at. When you have just original Medicare, you're going to pay a share of the cost. Medicare does not cover everything. So it was intended to cover all of your retiree healthcare expenses, kind of like Social Security was never intended to be able to be the sole form of income for somebody, but it's going to help towards cost. So you will be expected to pay the remaining cost with that. So what happens with original Medicare? So I'm looking at 2020 because if you have not enrolled in Medicare supplements or Medicare Advantage at this point, you're looking at 2020 with this. So most people don't have a monthly premium for Part A. As long as you've had 40 tax quarters or 10 years of Medicare taxes, you're going to get Part A at no cost. You are, however, going to have a Part A annual deductible of $1,408 a year starting in 2020. You're also going to have co-pays for hospital and skilled nursing stays, and you can see those here as well. Depending upon the length of the stay, you're going to have different out-of-pocket costs. For example, let's say that you spent 70 days in the hospital. You wouldn't pay anything for the first 60 days. That's totally covered. But then you're going to pay $352 a day for each day after that. So $3,520 for that stay, assuming you left the hospital after those 70 days. And if you went and spent 25 days in a skilled nursing facility, you're going to pay nothing for those first 20 days, but then you're going to pay $176 a day for each of the remaining 5 days. So if you look at that, your total out-of-pocket between those two things, $4,400. So let's look at Part B. So Part B, your premium is going to adjust depending upon what your adjusted gross income was from 2 years before. So if you're going to have a really big windfall this year, maybe you sell a company or something like that, it's going to affect what your Medicare cost is for Part B 2 years from now. So that premium ranges anywhere from $144.60 per person up to $491.60. It's a big difference between those. So Part B is going to cover doctor services, but it doesn't cover them completely. So it's going to pay 80%, but you pick up the other 20%. So it can mean that there's a lot of out-of-pocket cost with original Medicare. If we look at the average out-of-pocket cost for somebody when it comes to that, there's a lot that people are on the hook for. So the average out-of-pocket cost, $135.90 for the Part B premiums. This is looking back in 2019. This is somebody in good health. Other premiums, $0, $38 for inpatient care. You can see total with that on a monthly basis, about $654. But let's say that you've got some pre-existing conditions. Let's look at the difference of that. You can see on average in 2019, you're looking at $7,850 per year out of pocket, even if you're in good health. If you tack onto that maybe you have something like diabetes, your average out of pocket anywhere from a little over $10,000. You can be over $12,000 if you have congestive heart failure or had a heart attack. So when you're looking at that, there's a lot that you're on the hook for if you're not healthy. Even if you are healthy, there's a lot that you're trying to make sure that you can mitigate. How much are you on the hook for? So that's where something like a Medicare supplement would step in. So this is going to be unlike original Medicare because the supplement is designed through a private insurance company, not the government. So insurance companies like your United Healthcares of the world or Cigna or any of those, they're required to offer the same basic benefit for each lettered plan. So remember that alphabet soup. We've got A through N, but they do have the ability, they can charge different amounts. So the companies all have to cover the same stuff, but the plan, the amount that you're paying can change. That's something I look at for people on a daily basis to be able to see, are they going to be in the best setup for themselves now and moving forward. So those Medicare supplement plans are going to help what original Medicare leaves as a gap. That's going to be your co-payments, your co-insurance, or yearly deductibles. So let's look at those various types of Medicare supplements. Regardless of which insurance carrier offers them, the coverage is going to be the same across the board. You know, Plan A is the most basic coverage, and Plan F right here is going to be the most extensive coverage. It covers nearly all potential cost. But starting January 1st of 2020, Plan C and Plan F are no longer available to people new to Medicare. If you already have either of those two plans, or the high deductible version of Plan F, or if you're going to be covered by one of those plans before January 1st, so maybe you've already enrolled in it, you're going to be able to still get those plans. If you were eligible to be on Medicare before January 1st of 2020, but you have not yet enrolled, you can still be able to get one of those plans as well. So depending upon your situation, there's certain plans that provide better value than others. So let's look at where most people enroll, just narrow this down. If I look at that and I say plans G and N right now are the most common plans selected by enrollees. And previously it used to be Plan F because it covered nearly everything. So Plan G is going to offer the second most comprehensive coverage. It covers everything that Plan F covers except for the Part B deductible of $198 per year. Plan N is going to be really similar to Plan G, but it's going to require you to pay a $20 copay when going to the doctor and $50 as a copay when you go to the emergency room. So you can see those are going to be your most comprehensive plans that are available. With Plan G, remember, it's going to give you the same coverage that people were used to with Plan F. You just have that $198 deductible to pay for the year. The difference in cost for many people is better than that $198 deductible. So we have a lot of people that are switching to that anyways, that were previously on Plan F. So let's look at the numbers actually in action, show you an example of somebody who's on Plan G. So as I mentioned before, the supplement's going to pay for the Part A deductible. So it's going to cover that. Part B co-payments and excess charges and hospital, and skilled nursing co-payments. So that's all going to be covered. So your total out-of-pocket per month in this example of somebody on Plan G, $264 a month versus the average out-of-pocket of $655 a month. You can see it's given you a lot more structure and stability to what your actual expenses were going to be on a monthly basis. So it's going to give you that peace of mind knowing that you can accurately budget and know what your monthly health costs are going to be and avoid those unexpected medical expenses. So assume that it's a 65-year-old male, he has the Part B premium of $144.60, and that this person is going to be non-tobacco. So it doesn't matter if somebody uses tobacco or not when it comes to this. So it's going to help avoid those unexpected. When we look at original Medicare, if we review what that Part A and Part B costs were from earlier, we can look and see where Part G steps in. So it's going to cover the Part A deductible of $1,408 a year. It's going to cover the copays up to 150 days of a hospital stay. So those go away. And up to 100 days of a skilled nursing stay. So it's also going to cover 20% of our out-of-pocket costs for Part B. So the only thing left for you to pay is going to be that Part B deductible of the $198, as well as the premium cost for the Plan G policy. So you can see there's a substantial elimination of expenses that you have across the board. So how do you actually know which of these options is going to be right for you? So you have to understand what's available to you to know what's going to be the best fit. It's not a one-size-fits-all. Although we're saying Plan G is where most people are going right now, it doesn't mean that it's best for you. We would want to look at that individually. Part D is going to be an optional coverage, but if you decide to delay taking this, you might potentially have a late enrollment penalty because it's federally mandated that you have coverage for drugs. There's a lot of programs. If you go to Medicare.gov and you put in your zip code, the prescriptions that you're taking, it can give you a list of options available. So you usually get this Part D coverage one of two ways. So that standalone that I was talking about through Medicare.gov that you can go look at, or through a Medicare Advantage plan. So if you've got that Medicare Advantage plan, you're not going to have the standalone. So prescription coverage, you're going to pay up to $435 in drug cost before you pay, before Part D starts picking up any cost. So after you pay your plan's deductible, if your plan has one, the amount you pay for each prescription is either a co-payment, like say for instance $10, or co-insurance, which is just a percentage of the drug. Say it's a 25% co-insurance. If the combined amount that you and the drug plan pay for the prescription drugs reaches $4,020, you've entered what's called a coverage gap, or you might know it as the donut hole. And this is going to be where there's no coverage. There's going to be discounts on generic and name brand drugs, but there's no coverage. You have to wait until your total cost now has reached $6,350, and that's going to move you up to catastrophic coverage. So Part D is going to begin at that point to pay up to 95% of the drug cost, but you're going to pay either the greater of 5% of the cost or $3.60 for generic, $8.95 for brand name prescriptions. So prescription drugs is something to be aware of and know how that's going to be affected by what you're doing. So why do you need to pay attention to enrollment dates? As I stated earlier on in the presentation, We're just wrapping up. Tomorrow will end the annual election period for Medicare Advantage plans. These are marketed heavily every year. People are led to believe that that's the only option that they have, and the Medicare supplement is not going to be in their best interest. If you have not elected to be able to have a Medicare Advantage plan and you're newly becoming eligible to get coverage, you can get that Medicare supplement throughout the year. Medicare Advantage plans, yes, you are going to reach the end of enrollment tomorrow. You're going to have a period of time where you can make changes next year. So who's going to be eligible for this type of coverage? You have to have Part A. So at age 65, you're going to be eligible for Part A and B even if you're still working. So let's say that you work for an employer that has less than 20 employees and you want to sign up for Original Medicare. That's going to be your primary insurance. But if your employer has more than 20 employees, you can actually delay taking your Part B and not pay a penalty. So I've seen this a few times throughout this year. Somebody's worked for a larger company. They might be 67, 68 years old, and now they're just enrolling in Part B. They haven't had to pay a penalty because they had coverage that was sufficient, and they were able to delay that. So don't worry, just make sure that you need to know the specifics. If you have those type of questions, let me know. We can set up a time to have a conversation. So there is automatic enrollment in Part A and B. So if you're already getting Social Security benefits, for example, you're getting early retirement at least 4 months before you turn 65, you're automatically going to be enrolled in Part A. That's the hospital insurance, and Part B, even without an additional application, because it's going to be ready to kick in when you turn 65. So you have open what's called an initial enrollment period. And that's going to allow you to be able to, 3 months before you turn 65, you're going to get this package which kind of explains your benefits here. So you're going to get your Medicare card. It used to be your Social Security number was your Medicare number. That has in fact changed, so you should have new cards that have that on there. It's going to tell you your effective dates for those coverages. That's important because you need that when you're enrolling in coverage, whether it's a Medicare supplement or a Medicare Advantage plan. So that initial enrollment period that it's going to go into more detail about, it's the 3 months prior to turning 65, the month that you turn 65, and the 3 months after. So you really have a 7-month period where you can enroll in this, and you don't have to worry about qualifying medically. If you retire after 65, that enrollment depends on when your employer-sponsored coverage ends. And if you newly qualified due to disability, you're also going to have that initial enrollment period. But it is very specific to each person and the circumstances. So make sure that you pay attention to that, because the last thing that you want to do is to pay a penalty for the rest of your life because you delayed by mistake taking these coverages. So Medicare supplement, there's enrollment periods that people have to be aware of. The open enrollment period, that starts the month of your Medicare Part B taking effect, and it lasts for 6 months. So you're guaranteed that they're going to offer you coverage because they cannot take into account your health status. You could have a heart attack, a stroke, all these things that are wrong with you. Regardless of that, they still have to give you coverage and not penalize you. During a special enrollment period, you're going to have that guaranteed issue with qualifying circumstance. So not all the plans are guaranteed issue under those special enrollment periods, but sometimes it happens. And if you're outside of the enrollment period, so let's say that you might be 70 years old, you've had a Medicare supplement now for 5 years, and you're looking at changing, you're not guaranteed to get coverage from a new insurance company. You have to medically qualify. So that is something to be aware of when you're making these changes. So those important dates to remember when we're looking at this: October 15th through December 7th. That's that heavily marketed time where it's an annual election period for Medicare Advantage plans and prescription drugs. That's going to be for it to take effect on January 1st of the next year. So the enrollment period that ends tomorrow, that's going to be for starting January 1st of 2020. From January 1st to March 31st, you're going to enter an annual disenrollment period. So that's where you could decide, you know what, this isn't for me. you can return to original Medicare. So you can move off of that Medicare Advantage plan and you can move back to original Medicare. But you can only make the changes to your plan due to special conditions outside of that, like if you move out of your plan area. So a lot of this is zip code linked. If you move too far out of that, it's going to open it up to where you're going to need to find other options. So where can you find more information about this? Of course, you're free to reach out to us so that we can help you out, but a great place to go, phenomenal resource, is Medicare.gov. There's an annual handbook that's printed out that it says Medicare and You, that's released every year with updates, so that way you can have that ready to go. There's a link on there that says Choosing a Medigap Policy, a guide to health insurance for people with Medicare. That, again, is developed to be able to help bring more clarity to this decision so that you can know what effects it can have with your choices. So we covered a lot about Medicare, Medicare supplements, and Advantage plans in our conversation today. As I stated, it took us about 24 minutes so far. There is a link to the right-hand side if you have specific questions for yourself that you can click on and schedule a time individually with me where I can help go through and look at options for yourself. Even if you're already on a Medicare supplement, it might make sense to change to a different type. So if you have Plan F and there's no new people moving onto that plan moving forward, those costs could rise sharply in the near future. So it might make sense while you're healthy to make changes to Plan G. So with that being said, I thank all of you for spending time on the call today so that we could go through this. We will be doing more of these webinars starting next year, so we hope to have one each month, as well as have these posted on our website that you can share with others that might benefit from the conversation. If you have specific questions, you can call us at 407-299-4129 or click the link to the right so that we can set up a time to individually meet with you. I thank you and hope you have a great day.